Welcome to Our Issues Birmingham. Another beautiful day in Birmingham. I'm fortunate to have my good friend, Senator Doug Jones, with us today as our guest. Doug, thanks for taking the time to zoom in, as they say in this day and age.
Hey, it's my pleasure, Tom. It's been a long time since we've done this. I appreciate the opportunity.
I think it was just before your election.
It was. When you tape these things, my schedule's been a little crazy since January of 2018. So I'm at home now with all that's going on. So great opportunity to reconnect.
Well, obviously the thing on most people's minds is the health crisis, the pandemic that's going on throughout the world. And fortunately, even though the numbers are still up a little bit, we're seeing some positive things that are lurking out there that we feel like the social distancing and the stay-in-place orders that are entered are making a difference. Can you address that for us?
Yeah, absolutely. There's no question. I mean, people have been saying from the very beginning of this, our health officers were telling people, this really works. I mean, it worked even in the 1918 pandemic that cost the lives of so many people. This social distancing and staying at home, all of those things work. And we're beginning to see the evidence of that now. If you think back a little bit, it was like 28 days ago, in that interim period where measures across the country started coming in, particularly in New York, New Jersey, and those places, where the orders were coming in and people started really clamping down. It took other states different times since this. And we're seeing the effects of that. Clearly that we are seeing the effects of that because all of those things absolutely worked. And I just got off the phone with a group of colleagues, the vice president and Dr. Fauci. And Dr. Fauci was making the point. He actually was making 2 points. He said, what we're seeing is that the social distancing and the stay-at-home orders, all of that is working. It will work better if people will continue to adhere to it. But that's the way to stop the spread. The second point he was making, though, Tom, is that we should not let our guard down. Even though we're seeing the curve blunt, we're seeing some progress made, we still have a ways to go. This, in his words, this is not like turning a light switch on and off. You can't just say, okay, it's worked, here we go, let's go back out and have a good time. We can't do that. We're going to be in this for a little bit longer. But clearly the health outcomes are getting better and we're seeing light at the end of the tunnel.
How are we doing equipment-wise, and what is the federal government doing to try to facilitate getting equipment to the places where it needs to be the most?
Well, we're still struggling with equipment. We're still struggling with the personal protective equipment, especially ventilators. I have been disappointed in the federal government's response, but I think they're doing better. We're trying to get a handle on the supply chain. That has been the biggest issue. We were not prepared for this. We did not see the need for this, or at least the administration didn't see that need to try to do things earlier, to try to get more masks made, more ventilators made, more gowns made. So we're a little bit behind the curve, and that's why I think people have gotten so aggressive on the social distancing and stay at home, because what we're seeing, for instance, like in Washington and California, they got ahead of it a little bit. Gavin Newsom, the governor out there, got ahead of it. And California is actually seeing, they may not see the kind of same surge that they were predicting a couple of weeks ago because of very aggressive efforts out there. So the equipment that's coming in is getting distributed. We're going to need more. There's no question about that. But if we blunt that curve and continue the progress we're making, hopefully we will have a better handle on it. The biggest issue is testing. We still are behind the curve in testing. We're trying to get the test out, more of them made. There's some coming into Alabama this week. I think they're up to maybe doing, I forget what my note said, about 3 million tests per week. That's not near enough. We're going to need a lot more. And those are the tests, the swabs that you hear about that can give an answer as to whether or not somebody that's being tested has the virus. We're also going to need some antibody tests, the serum tests that are coming as well, because we've got to keep track of this for some period of time so that we know who can get back out in the workplace, how we can do things. Testing is continuing to be a problem, and we're working on it.
Are you in any conversations with our governor? by the
You
way?
know, I touch base with Joe Bonner on occasion, their chief of staff. Governor's pretty inundated, but I'm in touch with state officials on a regular basis. Um, Joe Bonner, chief of staff, and I have talked on a couple of occasions. Um, Scott Harris and I regularly communicate. He's the state health officer. Don Williamson, Alabama Hospital Association, and Brian Hastings. Brian Hastings is our EMA director and is doing a great job because it's his job to help get a lot of these masks, get a lot of the equipment. And he's also right now, as we're speaking here on this Thursday, there is the Army Corps of Engineers that is going around the state looking at potential sites to set up hospitals should they be needed. People may have seen what they've done in New York at the Javits Center. We've had a Birmingham construction firm that got a contract to do the same thing at the Civic Center, I think, down in Miami. We're looking at various places in the state of Alabama right now, the Corps of Engineers, and anticipating perhaps needing it. If we can keep blunting that curve, maybe we're not going to need that, but they're making those contingency plans. So yeah, I'm in touch regularly with the state folks and with the FEMA folks and the folks in the administration.
Well, I don't want to go into too much detail on this, but there was some criticism out there about what took so long for our governor to put the stay in place order in place. So we'll talk about that when we come back from break and some other things. So don't go away. We'll be right back with Our Issues Birmingham. I'm Tommy Spina. I'm speaking with Senator Doug Jones. We'll be right back. Welcome back. This is Our Issues Birmingham. We're talking with Senator Jones, and I can't help it, Doug. I'm going to call you Doug, all right?
That's fine. Please do.
Let's talk about what Congress has done, the Senate and the House of Representatives have done with the new stabilization package, or the package that was introduced that injected the capital into the economy.
Sure. We had three packages that we did. One came very quickly. Senator Shelby, Senator Leahy, on the appropriations chair and ranking member of appropriations, put together an $8.3 billion package that we got out really quickly to try to get to hospitals to buy equipment, do some things. That seems like years ago now, but it was only about a month ago. A second package dealt with nutrition for kids, for seniors, also a little bit more trying to get equipment, those kind of things. The big package was the $2 trillion package that we call COVID-3. That was really, a lot of people call it a stimulus package. I call it stabilization because the economy was in total free fall and we had to do something to stabilize it. That did a number of things. It provided $133 billion to go to hospitals to deal with this crisis. Hospitals are losing money because all of the hospitals around are now not doing the elective things that actually make them a little bit of money, and they're treating these patients and getting ready for it if they're not treating patients. So that money goes to them. It also helps individuals. There's been a lot of talk about a $1,200 stimulus check that goes to individuals that make less than $75,000 a year. It will phase out after that. That's going to be in the form, hopefully, of bank deposits. If you've got your bank information on your tax return or your Social Security, either way, that money should start coming in the next 2 weeks, is what I heard today from the Secretary of the Treasury. There'll be a second round where people get literally physical checks. And that's a little bit of a problem because that's either going to take longer, but the Secretary of Treasury said today that they're establishing some portals where people can go and put their bank account information in. That could speed the process up. I've urged him to use a debit card, like a gift card, because that's what it is. It's a gift. It's not taxable. It's a gift, a pay down debit card. We'll see if that goes anywhere. There's also unemployment benefits. The federal government has extended unemployment benefits up to 4 months, provided an extra $600 per week for people that are getting laid off or unemployed as a result of this virus. But we're also encouraging small businesses to keep these folks afloat. And that is keep them on, keep their benefits. And that's that payroll protection plan that they were working through the SBA. We're seeing some kinks in that right now, but it looks like it's getting smoothed over. Tommy, I'll tell you, and we can talk about this a little bit later, there's a lot going on with that package. We're tweaking it because there are things that we see now that we needed to do or change the language a little bit. But it was a great package. It passed the United States Senate 96-0. And think about this. This was the largest financial package in the history of the United States. It was more than our discretionary federal budget that we passed last year. Congress did it in about 2-week time, very bipartisan, give and take, get a little nervy sometimes with folks. But at the end of the day, 96 senators voted for it. We'd have had to, all 100, I'm convinced, but 4 had to be quarantined for this. So great package.
Was something put up today that didn't pass?
Well, yes and no. I was really disappointed in the way Senator McConnell runs the Senate sometimes. And today was a really good example. He had a package that he had not talked to anybody about, that he wanted to put more money in the SBA fund, which everyone agrees with. I agree with, all the Democrats agree with. But he did this on his own without talking to anybody, without trying to figure out, is that the right amount of money? We should be putting it in a different way. For instance, I've got a whole program that it's getting a little traction of using payroll processors to help funnel the payroll protection plan. But he wanted to put it in there and put it up for a unanimous consent vote. I don't even know what it was other than just dumping money in. No one thought that was a good idea right now. The program's not that old. It's 4 or 5 days. We've seen problems with it. We've got banks who are inundated. They're trying to do the right thing, but yet there are also a lot of people in this country that are getting left out, small businesses. So there were a lot of problems with trying to do it the way he did, but he did it simply so some Democrat would, and I try not to be too political on your show, but the fact of the matter is, this was a political stunt, him bringing that to a vote, knowing it wasn't going to happen, just so he can now say Democrats blocked something. Well, the fact is Democrats had their own bill that they put up too, and he blocked it. So, I was not happy about that. I still think it was the wrong way. We've got to talk to each other. And I think the American people and people in Alabama do not care to see these political games going on. What they want to see are people working together. And they are working together, but you wouldn't know it just from the political stunts that happen on occasion.
Well, I hear some things, 2 things. One, my own observation, and that is, I hear from bankers that go like, we got to hurry up and get this paperwork in because they're going to run out of money. That is one thing I hear over and over again. And 2, are we throwing a thimble of water on a raging forest fire? Or are we injecting enough capital to actually put the fire out?
No, the answer to that is no. I would say we're throwing more than a thimble of water on it. But clearly, when we passed this package, I know I did, and I think so many of the members of Congress in the Senate and the House did not feel like that this was going to be enough. We felt like we were going to have to come back and do some things, but we needed to get money going as quickly as we could. So I think that's what we're looking at. The minute we left Washington, D.C., people started talking about the next package. And the bigger problem that we've got is whether we try to craft one other big package or whether we do it in increments. And there's pros and cons to both ways from a legislative standpoint. But the small businesses and worker protection, we clearly don't have enough money. We're not going to have enough money for the hospitals. And we're not going to have enough money for state and local governments as well. But the fact is, the one that we passed tried to catch a lot of different people. And it really was one that we hammered out in a good way. There are things, Tommy, and you can imagine when you've got what they call a must-pass piece of legislation, people are trying to put in all sorts of pet projects. Some of those got in. There's no question. There's some things in the bill that I wouldn't have wanted in there. Republicans got some in, Democrats got some in. But at the end of the day, that's part of the negotiating process. And so that when you get to a point, everybody will hold their nose on the things they don't like, but consider the whole package, which was good for the American people. And so we were able to do something that we could then send over to the House and they could pass it without an amendment. And that's the important thing to do. Go from one house to the other with no amendments, get it onto the president's desk.
All right, don't go away. We're going to take a break. We'll be right back. This is Our Issues Birmingham. Welcome back to Our Issues Birmingham. I'm Tommy Spina, talking with Senator Jones, Senator Doug Jones, our local senator from Birmingham. So let's talk briefly about the restaurant industry, the entertainment industry, for starters, and what we can do to get them back up and running, because they have really taken it on the chin in the wake of what's gone on here.
Yeah, they absolutely have. And Tom, that's going to be a very strategic plan. We can't, and no one should think that we can just all of a sudden flip a switch and get this back and going. Some of this testing is going to be important, because we need to make sure that people are back in the working that have either tested in a way that they are immune, or we can get things going. I think what you're going to see in the next month is a separate a task force that the administration's got on exactly how to do that and get that going. But it is going to be a gradual process. Don't expect by June to be going to concerts again, because I just don't think that that's feasible to happen. What we've got to worry about is a second surge. And so we've got to do those things to protect people so that we can open up and do it in a safe way, and not all of a sudden get in this problem again late summer or next fall.
Yeah, but we got to get people out. So we could always put back in place the 100% meals and entertainment deduction as well that was removed some time ago.
There's
that
a lot
might
of
stimulate
things. Yes, there's a lot of things that we can do to incentivize people to do that. But again, we've got to do it in conjunction with our health authorities and what they're giving us the advice on. This is going to have to be driven more by the healthcare people than it is the economics right now. That's one of the problems that we had early on. People were looking at the economics more than they were the health. And so that got us into a little bit of a problem and behind the curve. Let the data drive it, and it will happen, and it will happen in a methodical way.
Speaking of health, I know you're a proponent of expanding Medicaid. We've been behind the 8 ball on that for so long.
Yes.
And the effect of it has been to eliminate medical services to poor people, to certain segments of our population, I think. Whether it's intended to do that or not, it does. And I think copays are also an issue that kind of spills into that. What would you say to Governor Ivey about expanding Medicaid? And what would you say to the Congress about letting us go back in with the matching funds?
Yeah, no, I would say to Congress, let's give some incentives to the states to do it. I've got a bill pending that would do just that, pay 100%. Perfect time to do this right now. I would tell the governor, the legislature, expand Medicaid. We're behind. We've lost billions of dollars, number one. And what this pandemic is showing, Tom, is shining a light on all of those disparities that you just mentioned. Racial disparities, urban versus rural disparities, all of those things where healthcare is at its worst in a state like Alabama and around the South. If we expand Medicaid, we would get 340,000 more of our citizens good healthcare. The one thing that this pandemic has shown is that people are now realizing all this social distancing and all of the stay-at-home measures, that's having another effect too. And that is that people now begin to see more than ever that their neighbor's health is directly related to their own health and vice versa. And so if we can get better health outcomes for all Alabamians, especially the least of these that need it the most, which are, by the way, mostly working folks who are just not making enough money to buy health insurance, but they're out of the loop for Medicaid as it currently stands. If we can get better health outcomes for them, it's going to put more money in the state. It's going to help our healthcare industry, and it's going to make for a healthier Alabama, because as you know, we are one of the most unhealthy states in the country. That is why we're such at risk for this virus. We have all of the pre-existing conditions throughout the state. We're at the top of the list in the country.
You know, the copay issue, if we just leave that up to the provider, to me, would make plenty of sense. If the provider wants to accept what insurance pays and call it a day, that would be fine. the copays, some people can't afford a copay. Some people pay exorbitant amounts of monthly rates, and they end up with a $4,000 deductible in their policies, and they can't pay that either. So how do we overcome all that?
I think we're going to be. I think you're going to be seeing another look at all of those issues. Copays are important. Special enrollment periods right now are important for people that have lost their health insurance. I think everything's going to be on the table. What we need to be doing, Tom, is we need to be taking this right now and trying to do those things that we feel like can make a better state and a better Alabama. And just quit talking about. We now see the problems in a spotlight. Let's do something about them.
We got so much we could talk about, but we're not going to have time to talk about it. So perhaps maybe a week or two later, you might come back and be with us. Is that possible?
Absolutely. You just let me know.
And we'll reevaluate where we are then versus where we are now, and we'll see where we're headed. Thanks for being with us today. I know you're a busy man. I know you're talking to lots of folks all the time. This is Our Issues Birmingham. We'll see you next Sunday.